Psychologists, which patient made you tremble with fear? When you're a psychologist, you learn to let yourself be guided by data, science, and observation. You separate reality from the imaginary. Or at least that's what you always think. I knew I would encounter difficult patients, people with deep traumas, irrational fears, and dark thoughts. But nothing prepared me for meeting the man with the black notebook. I remember him with complete clarity. It was a cold afternoon, one of those when the wind hits the windows and the sky looks like it's about to collapse. My secretary had told me that the new patient's name was Mauricio Del Rio. I didn't know much more about him. He had urgently requested the appointment, claiming it was a matter of life or death. There was something in his voice that unsettled me. A deep, almost monotonous tone, as if the words weighed too much on him. When he entered the office, I couldn't help but feel a chill. He was tall, thin, about 40 years old, with a gaunt face and deep dark circles under his eyes that gave him an almost cadaverous expression. But what caught my attention most was the notebook he was carrying under his arm. An old black notebook with worn corners. He held it so tightly that his knuckles were wide. We sat face to face, and for a few minutes. He didn't say anything, he just stood there staring at me as if he were being evaluated. I was used to the awkward silences in sessions, but this one was different. There was something in his gaze that made me feel as if I were the patient. "Mauricio, really?" I finally asked him. Trying to break the tension, he nodded slowly. "What brings you here?" I continued. He didn't respond immediately. He looked down at the notebook and opened it with precise movements. The pages were full of strange symbols, drawings of humanoid figures, and phrases that were repeated over and over again. I managed to read some. "The shadows are always watching, there's no escape. They are here," he said in a low voice, almost a whisper. "There are?" I asked, without showing surprise. I thought it was a hallucination or some kind of persecutory delusion. It was common in patients with schizophrenia or psychotic disorders. Mauricio looked up and stared me straight in the eyes. The shadows responded with chilling seriousness. "They are everywhere. You can't see them. But they see you." I made notes in my notebook, trying to stay calm. It was important not to validate his previous beliefs, but neither was I to challenge them. I asked. Since I was a child, at first, I didn't know what they were. I thought they were part of my imagination, but over the years I learned that they were always there, waiting. There was something in his voice that gave me goosebumps. It wasn't the content of what he was saying, but the conviction with which he said it. He didn't seem like a man lost in his own mind, seemed like someone who had seen things others couldn't see. The subsequent sessions only increased my anxiety. Mauricio spoke more and more about the shadows, how they watched him when he was alone, how they whispered his name in the dark. But the most disturbing thing was that little by little he began to reveal details of my own life. "How is your daughter?" he asked me one afternoon. Casually, I felt a knot in my stomach. I hadn't told Mauricio anything about my family. I never mentioned personal details to patients. "How does he know I have a daughter?" I asked, trying to sound calm. "They told me. The shadows know everything about you." For a moment, I didn't know what to say. It was impossible for him to know that, but his expression was one of absolute certainty. From that day on, I began to have nightmares. I dreamed of dark figures moving in the corners of my room, with whispers calling my name. I would wake up in the middle of the night, sweating with the feeling that someone was watching me from the nearest shadow. The worst happened one night after a particularly tense session. Mauricio had shown me one of his drawings, a circular symbol surrounded by cross lines, something that seemed vaguely familiar but I couldn't identify. He told me it was a mark that shadows left on those they wanted to take that night. When I got home, I saw it drawn on the front door with what looked like ash or dark dust. There was the same symbol. I looked around hoping to see someone, but the street was deserted, my heart beating uncontrollably. I cleaned the mark as best I could and entered the house. From that moment on, my life became a spiral of paranoia. The noises in the house seemed to amplify, the shadows lengthened unnaturally, and I always felt that someone or something was watching me. Finally, I decided to refer Mauricio to another specialist. I needed to distance myself from his case, to regain my sanity, but the fear didn't go away, even years later. Sometimes I find that symbol in random places, on a window, fogged up in the dust on a shelf, on the wall of the office. I always erase it immediately, but the feeling of being watched never completely goes away. I've come to accept that maybe there are things we don't understand, things that hide in the dark corners of our perception, and every time I see a shadow lengthen in an empty room, I wonder if Mauricio was right. And if the shadow is always there, watching us, waiting for the right moment to reveal itself. If you're enjoying it, subscribe. Being a psychologist has taught me that the mind is capable of constructing surprising realities, some so detailed and vivid that they sometimes become difficult to distinguish from what we call reality. Patients with hallucinations often describe terrifying experiences that defy logic, but what happened to me with this patient was something I had never expected to witness. Even today, I can't look in a mirror without feeling a shadow of that fear that has haunted me ever since. Her name was Valeria. She was a young woman of about 25 years old. She had come to the office with a previous diagnosis of dissociative disorder. Although her mother warned me that her symptoms had worsened during the first session, Valeria seemed withdrawn, her eyes constantly fixed on the floor. She responded in monosyllables and avoided any eye contact. It wasn't until I mentioned mirrors that she suddenly looked up, as if I had read her mind. "Why did I mention that?" she asked. In a tense voice, I explained that I had reviewed her medical records, which mentioned that she had an obsession with mirrors. She seemed to fear them, but she also needed them in some way. Valeria looked at me with an intensity that made me uncomfortable. "They don't want me to talk about that," she murmured. I frowned. "Who are they?" She remained silent for a moment, then, after a few seconds of hesitation, she told me something that left me cold. "The others, those who live in the reflection." When I heard that, I thought it was about a form of personification. Perhaps a manifestation of her trauma. I tried to investigate further, but Valeria closed the subject in a barely audible whisper if I spoke too loudly. They got angry. The following sessions were a slow descent into the unknown. Valeria explained to me that since she was a child, she had felt that her reflection had a life of its own. It wasn't like the reflection of any normal person, it didn't simply copy her movements. According to her, there were moments when her reflection would completely stop or move before she did, as if out of step with time. At first, I thought they were simply delusions, a construction of her fragmented mind, but the way she described it was too detailed, too consistent. She spoke of the other Valeria as if she were an entity with her own intentions, someone who lived in the mirror and knew things she couldn't explain. Sometimes she spoke to me, confessed to me one afternoon, telling me things I don't want to know. "What kind of things?" I asked, writing down in my notebook, "Secrets, things about other people, things I can only see when she shows them to me." I asked her to give me an example. Valeria hesitated for a few moments, as if afraid of betraying someone invisible. She finally lowered her voice and told me something that left me frozen. "I remember the lady at reception," she asked, and I nodded. "She's sick, very sick." The other Valeria told me, and showed me how her organs are failing inside. That statement seemed absurd to me. The receptionist. Although older, she had always enjoyed good health. However, a couple of weeks later, her daughter came to the office to inform me that her mother had been urgently admitted to the hospital for kidney failure. This incident left me thoughtful, but I tried not to give it too much importance. However, things began to become more disturbing. Valeria arrived one day with a small hand mirror wrapped in a black cloth. She held it carefully, like if it were a sacred or dangerous object. "We could use this in the session." He asked me why I want him to see what I see. I agreed with some reluctance. He placed the mirror on the table separating us. It was an antique object with a silver frame, blackened by time. For several minutes, nothing happened. Valeria just stared at it, her lips moving in a barely audible murmur. I watched with curiosity, waiting for some kind of reaction until something happened that I can't explain. The reflection in the mirror seemed off. At first, I thought it was an optical effect caused by the angle of light, but it wasn't. Valeria was motionless, but in the mirror, her reflection seemed to move slightly, as if breathing independently. I moved closer to examine it. It was then that the reflection turned, looking directly into my eyes. My blood froze. Valeria continued looking at the mirror, without moving a single muscle, but her reflection smiled at me. I stepped back. Suddenly, he saw it. Valeria asked, as if she knew exactly what had just happened. "I think it was an optical illusion," I stammered, trying to regain my composure. "It's not an illusion," she replied. "She's seen you now too." I didn't know what to say. We ended the session. A little while later, but from that day on, things began to get worse. I began to notice small anomalies in my own house. The mirrors vibrated slightly, as if something wanted to get out of them. Sometimes, when I passed in front of a mirror, I had the feeling that my reflection wasn't moving at the same time as me. One night, while I was brushing my teeth, I clearly saw someone behind me in the mirror. When I turned around, no one was there. The sessions with Valeria became more intense. She claimed that the others were increasingly present. She warned me that I shouldn't look at them directly, that if I did, they might cross over. I tried to rationalize her words, but deep down, I was beginning to doubt my own perception. The last time I saw her, Valeria was pale and nervous. She handed me the mirror, wrapped in the black cloth. "I can't keep it anymore," she told me. "It's yours now. They chose you." I tried to reject it, but she insisted. I left it at the doctor's office, thinking it was part of her psychological transference process. But that night in my dreams, I saw something I'll never forget. I was in a room full of mirrors, all reflecting shadows that whispered my name. One of those shadows approached the glass, and the moment it extended a hand toward me, I woke up with a start. Since then, I've covered all the mirrors in my house. I don't know what really happened with Valeria, but I know it wasn't merely psychological. Sometimes, on the quietest nights, I hear those whispers again. And when I walk past a mirror, I avoid looking directly into it because I know if I do, they'll be waiting. Next story. Cases with children are always complicated. Their perception of reality is still developing. Their fears tend to be disproportionate, and it's often difficult to differentiate between deep trauma and an overactive imagination. But Andres's case was different from the beginning. Something in his behavior made me feel like there was a dark truth behind his words, one I could never fully understand. Still, sometimes I feel like those whispers he described continue to echo in my mind. Andres was 8 years old when his mother brought him to my office. He was a thin boy with large, dark eyes and an expression that didn't match his age. He seemed always on the alert, as if he were expecting something terrible to happen at any moment. His visibly worried mother explained to me that for months, Andres had been having recurring nightmares and talking to himself, especially at night. He says he has imaginary friends, but the strange thing is what he mentions about them. He told me during the initial interview. "What kind of things does he say?" I asked, writing them down in my notebook. "He talks about people who are dead, names that we don't know each other, but he claims to have heard something at home." That caught my attention, although children often make up stories. The fact that mentioning deceased people wasn't common, I decided to start with an individual session to evaluate Andres. At first, he was reserved, avoiding eye contact and keeping quiet, fiddling with his hands. However, when I offered him a sheet of paper and pencils to draw, his demeanor changed. "What would you like to draw?" Andres asked him with a smile. He stared at me for a few seconds and then said, "Them." The answer left me puzzled, but I didn't interrupt him. He began to draw quick lines on the paper. What emerged from his hand was disturbing: human figures with deformed faces and completely black eyes. They were standing in a circle surrounding what appeared to be a door or threshold. "Who are they?" I asked softly, trying not to show my discomfort as my friends, he replied without looking up. "They live in the house, but they aren't always there. They only come when they want to play." His tone was neutral, almost as if he were talking about something completely normal. I tried to delve deeper into the topic. "How long have you known them?" "Since we moved in. At first, I only saw them in my dreams, but then they started talking to me when I was awake." My skin prickled slightly. The concept of auditory hallucinations isn't uncommon in children with anxiety or trauma. But there was something about the way he described those figures that didn't feel like a simple figment of his imagination. "What are they telling you?" I asked, trying to sound calm. Andres stopped drawing and looked at me directly. His eyes were filled with a strange mix of innocence and something darker. Something that shouldn't be in a child's gaze. "They tell me he's waiting," he whispered. The rest of the session was calmer, but those words remained etched in my mind. "Let's make sure we avoid accidents, disappearances, and unexplained phenomena, although I'm not a superstitious person." The information made me feel a weight in my stomach. The following sessions with Andres only deepened my discomfort. His drawings became more detailed, showing figures with increasingly defined features. At times, he described situations that seemed straight out of a horror movie: doors that opened on their own, voices calling him from the dark corners of his room, shadows slithering across the walls. One afternoon, while we were talking, Andres stopped in the middle of a sentence and looked toward the corner of the office. He frowned as if he were listening to something I couldn't hear. "Andres, is everything okay?" I asked, following his gaze. He didn't respond immediately. Then, very slowly, he said, "They're here to see you." The air in the room seemed to become denser. I laughed nervously, trying to break the confusion. "What do they want?" "Just look," he whispered. After that session, things began to change for me. I began to have strange experiences in my house. At night, I heard whispers that seemed to come from nowhere. Sometimes, when I turned off the lights, I saw shadows moving in the corners as if someone was watching me from the darkness. I tried to rationalize it by telling myself that they were just suggestions brought on by Andres's case, but the situation worsened. One morning, I woke up with the feeling that someone was standing at the foot of my bed. I quickly turned on the light, but no one was there. However, I could see a strange mark on the wall, as if small hands had left footprints there. I decided to face my fears and talk to Andres about what was happening. During our next session, I explained what was happening to me. He listened calmly, without showing surprise. "Sometimes they do that," he said, "they like to follow people who can see them." I repeated, feeling a knot in my stomach. "Yes, now they see you too. You." That was the last session we had. Shortly after, Andres's mother informed me that they were moving to another state. I didn't hear from them again. However, the strange phenomena didn't stop immediately. For weeks, I continued to hear whispers and see fleeting shadows in the mirrors. Over time, the incidents became less frequent, but they never completely disappeared. Even today, on the quietest nights, I feel like something is watching me from the dark recesses of my house. I don't know exactly what Andres was seeing, but I know it wasn't just a figment of his mind. Some children are more sensitive to things that adults can't perceive, and sometimes those things follow them and also those who dare to listen to their stories.